In products here, we have tinctures, we have vapes, we have topicals like creams and lip balms and these products, but we don't really know exactly what they actually do for us and or what is the best method of taking CBD. So can you take us through, and you gave me a little bit already, but what is the difference between inhaling and what is the difference for sublingual and topicals?
Yep. For CBD, if we're talking about CBD, and I know that Thailand has a cannabis program going on there as well, but if we're talking about CBD, CBD is generally used, if we're just using it for anxiety, right? If somebody is just a bit anxious, it can be used for anxiety. I find for patients in the medical program, they tend to have a bit more severe anxiety, but for mild anxiety, a puff or two is a great place to start because it's just going to work very, very quickly. But most patients with chronic symptoms with CBD, you're really going to need to take it orally. It's hard to dial in the dose of an inhaled product of CBD. THC is easy. You take too much, you know right away. So with CBD, typically patients with chronic symptoms, pain, they would use an oral dose every 6 to 8 hours, and they kind of would just slowly increase that dose until they found the effects were good for them. That can also be mixed with a very little bit of THC if that does come to Asia. A little bit of THC will increase the pain relief and not give a high feeling. It's only when you really get into higher doses. So oral dosing is typically structured around the clock for patients with chronic symptoms. And patients with just kind of acute symptoms, an inhaled dose would work well for them. I like the topical products as an added layer of relief. So as an isolated product, it might not give enough, especially if patients have a little bit more of an advanced kind of symptom going on. But on top of an oral dose, on top of an inhaled dose, to apply that topical product every few hours, even when it's really bad, can offer some nice relief as well. So it's just a matter of layering your products and adding other medications in as well. If they're dealing with chronic inflammation, adding some turmeric. In this country, ibuprofen is very popular, but you can't take it regularly or else you get severe side effects. So on bad days, maybe taking a dose or two of ibuprofen. You know, it's another tool in that toolbox that is much safer and less toxic than those other drugs. So it's just a matter of finding where it fits in there for patients. But oral dosing for chronic 24-hour-a-day symptoms, and for patients that just have acute symptoms that are more mild, they can use an inhaled product.
And what is your view on edibles?
As long as it's the right dose, it's fantastic. You know, we have patients with MS, multiple sclerosis, and with that, your symptoms are never going to go away. They're only going to progress. So most recently, I was discussing a patient, her flare. She was in a flare for months. She had a surgery and her whole body's electrical system just flared up where she was in chronic pain, 24 hours a day, unable to sleep. And so she started on a high dose extended release CBD tablet to help just bring that body's inflammation, because as the body stays inflamed, it's breaking down the myelin sheath on the nerves and progressing the disease. So you want to slow down the progression of the disease. So she was taking high dose CBD regularly and then using THC symptomatic for the spasms, because with multiple sclerosis, you get very bad spasms. So she was using a lot of inhaled to kind of meet that quick acute need. And then she was scheduling a 1-to-1, which is equal amounts of CBD and THC for her rough moments. And then regularly, without even thinking about it, she was scheduling CBD 24 hours a day around the clock to make sure it was always in there. And she found that was slowly bringing her out of her flare. So you will schedule CBD around the clock without missing a beat. And then a lot of patients will schedule THC when their symptoms call for it.